Hello, welcome back to our Senior Power Community Channel. Today we're going to be looking at, in somewhat of detail, something what we call the medical supermarket. And you will understand in a while why we call it that. Um, in essence, we are going to be providing information for this year's provider types that are certified or credentialized, as it's called, by these provider types. And this includes, just watch this, MDs, DOs, DCs, DPT, to name just a few. And the issue then becomes, are these types different? That is going to be the major takeaway of this podcast, as well as looking at how can we use the best of everybody, which I'm sure we all want. And remember this note, if you can read it, since we're talking about medical issues, we have to have this disclaimer that says we're not really giving advice, which we're not. We're just providing information. We're now going to go through a presentation of the agenda for today's discussion. And that includes a purpose for today's discussion, so everybody's on the same page in terms of what topics will be covered. Then we will provide a series of definitions for each of the health provider types as given by the Centers for Medicare and Medicaid. And then we'll do some analysis looking at the differentiation, the differences between each of the provider types, looking at its strengths and weaknesses or challenges, as is the more politically correct thing to say. And finally, we'll suggest in a bottom line, who might you use that will best suit your needs? We're going to go through it, and perhaps a teaming approach is the way to go, because you get the best, hopefully, of each of the players. Oh yeah, MD versus DO versus DC versus DPT versus NP versus P. Are you sufficiently confused? Well, stay tuned and we will remove some of this confusion, hopefully. The different types of providers taken together gives us big choices, very much like a supermarket. So we're going to compare these choices, or the availability of these choices, to a supermarket. And we're going to call this the medical supermarket. It's become like the shelves of an overstocked supermarket. So, of course, if we look at the shelves, you'll see products, and many of the same products do the same thing, but have a different brand and maybe a slightly different formula. So now we have to imagine this immigrant mother who comes from Ukraine. This is a real story. One of the people who worked with me was an engineer, and he came from Ukraine after the Chernobyl thing, settled here. But in the beginning, when they came, there were some interesting things. So the mother had to go shopping for food, and she went with her son and her daughter-in-law to this supermarket. And as she walks into the door, I'm not kidding around, she literally falls to her knees. And what it was is the fact that she saw all these choices, while in the Ukraine, particularly then and even today, more so, there was very little choice among products if that particular type of product was even there. And there's a message in that, okay? And the message for us is that we are becoming overwhelmed, and it's become very difficult to make the right choices. So, just like the supermarket, the healthcare providers look like, and indeed are, coming in a confusing variety of flavors, which does nothing at all to help us make these decisions. But we have to. So how does one make the informed decisions based upon valid information that might be presented to you, and sometimes it's not? Let's take a look at what the provider types are and how they are separated. And the following list is information that is according to the Centers for Medicare and Medicaid Services. So they are in two categories: physicians and clinicians. Physicians include MDs, or doctors of medicine, DOs, or doctor of osteopathic medicine. In some cases, depending upon what needs to be done, it could include a dentist, a podiatrist, and optometrist. And finally, the doctor of chiropractic medicine. How about on the clinician side? Well, we have the clinical nurse specialist, clinical psychologist, clinical social worker, nurse practitioners, physical therapist, physician assistant, occupational therapist, and speech language pathologist. This is quite a list here. And please note that the naturopathic doctors are not included in so-called original Medicare, but they are to a certain extent included in Medicare Advantage, depending upon the plan. So this is a long list, and we have to make some sense out of it so that we can all understand what the specialists are and what they're good for. Now we're going to go through now each one of these. Might sound boring, but if you're going to have to make these decisions, which you are, it's good to know what these people are all about. The good, the bad, the ugly. Okay, an MD is someone trained in what is called allopathic medicine. Don't worry about what that means. Let's worry about what it does. So they emphasize diagnosis and treatment of diseases primarily through the use of drugs, surgery, or radiation. Maybe the majority of the community goes to this type of provider. They focus on treating the symptoms as well as on the underlying causes of disease by employing evidence-based practices. No hearsay. The approach includes direct interventions, such as prescribing medications, doing surgeries, um, using radiation therapy as a means of managing or curing the medical conditions. So that's the positives. The negatives, the cons. Because they're so busy, there's only a limited time during appointments to see the physician, the MD. There might be even some communication barriers. Many of them will talk down to you or they don't know your language. You have fragmented care because a lot of times when you go into certain places, your particular physician, my MD, may not be there and they'll send somebody else. It can happen with everybody, but there is a high propensity of this to happen with the MDs. And there are prescription challenges, which we will discuss in other episodes. They are expensive. If you don't have insurance, you have accessibility issues or problems because they're, as it says below, they are not, may not be even enough of them in your area, and you have gross shortages. Right now we're up to the next type, which happens to be a doctor of osteopathic medicine, or more commonly referred to as a DO. And big difference between, um, allegedly between an MD and a DO is the fact that the DO will treat a patient as a whole person. That's their approach. So they emphasize treating the entire individual, not just to address the symptoms, such as a cough, that a patient may present to him or her. This promotes their ability to emphasize preventive health care for adopting a correct lifestyle and attitudes towards themselves. And this, they say, will combat illnesses. Interestingly, they also very strongly believe that the body of a person carries within it the ability to heal itself. It has an inherent ability to do those types of things. And then they use this manipulative treatment, which is similar to what chiropractors use, to diagnose and treat and also to prevent injury from occurring as well as illnesses from happening. In terms of negativity, there's not too much. Matter of fact, there's very little. Most of the negativity arises from the fact that there's a tremendous historical bias against them and limited global recognition. So that's something to keep in mind, that what you may have heard about them may not be true, that they are basically equal to an MD. The next type that we're going to be assessing is the doctor of chiropractic medicine, or as they are usually known and referred to as a chiropractor or a DC. They specialize in treating the so-called neuromuscular system, which involves the nerves, the bones, and the muscles of the body. And they are particularly interested in the way the back is aligned, because they feel if you do not have proper motion and function of the uh, of this neuromuscular system, that you're putting too much pressure on your nerves, causing these problems. So their approach is to align the back, just the back, to relieve this type of pressure on the nerves. Just as a DO, they emphasize nutrition and exercise as a key to support the body's natural ability, as a DO is saying, to heal and to fight diseases, which is a pretty powerful statement. Overall, their goal is to improve your physicality by reducing symptoms such as pain, although they even claim many other conditions, for example, cancer, to promote a balanced and active lifestyle. As you can see now, there is some issues with them in terms of perceived cons. Allegedly, they have a limited scope of practice. So they only will treat certain things, very specific. And whether or not it works, this approach, it's rather controversial. They lack mainstream medicine integration, and they have insurance limitations in terms of how much an insurance company is willing to pay for you to have these services. And they are trained and educated much differently than the others, than the MDs and the DOs, because their practice is much limited, much more limited. And they have shown to drag out the number of visits, and resulting in this overuse of care. Now we are going to get into some controversy, and that involves the differences and the role that these two types of practitioners fill, and that is the physician assistants and the nurse practitioners. Okay. Now, one has to remember that this is a rapidly developing healthcare trend. Okay. And the reason for this is a lack of the MDs and the DOs. So it's almost becoming standard that one sees one of each of those individuals, and the issue is how do they differ and what are their qualifications. So we're going to get even more confused here, and I apologize for this, but we'll try to work this out and see if we can make some sense out of it. Okay, so first, there are the nurse practitioners, and what they do, they're responsible for handling patient appointments and also routine exams to ensure the patient health. Furthermore, they have other more complex and detailed issues that they handle, speaking with patients about healthy lifestyle choices, completing diagnostic tests, and treating patients for both injuries and illnesses. Well, interesting, huh? And then the physician assistants. What they do is they provide services under the supervision of a doctor. Okay. And they work in different settings, which include hospitals and clinics. And they help patients with their routine medical care and are allowed to write prescriptions. Well, the issue is there's not really that much of a difference between the two. And things are becoming even more flexible where the nurse practitioners may be able to be allowed to write prescriptions as well. And the question is, can they truly carry out these roles? And we need to know more because there's not that much history or information about these particular types of providers. Well, I think it's sort of become pretty obvious, okay, that everybody has their strengths who are providers, and it would be best to take advantage of these differences and the different specializations and emphasis that these people have. So, how do you decide? Bottom line is, I'll cut to the chase. I'll make it easier for you. There's actually no need to choose. And in many respects, we don't have a choice anyway. So let's make the best of it. Let us build a Medicare credentialized team which will meet all of our needs, hopefully. And we take advantage of their complementary overlap, but also some of the positive differences. Okay? And in any event, as I said, you may not have a choice. So we have our nurse practitioners, MDs, DOs, PAs, chiropractors, physical therapists, and so on. Let us try to take advantage of each of these skills. I know that I have had to do this. I'm sure many others have done this in our who listen to this podcast, and not being out in the general public. So you have very strong possibilities and opportunities if you do take advantage, obviously, of everybody's skill. And for the most part, they are open to be to take on as providers for you. Let's talk about um, the next episode, and let me just begin by saying again, please understand these types. The choices are not that straightforward because indeed times are a changing, and big impact on the times is the lack of MDs and DOs, and there has to be a way of addressing that need. The next episode will be very special. It focuses on the great potential for dental scams. And I have there a case study on what one of our team members very recently experienced. It's a sad story, but there is a lot really that can be learned from it. And I've spoken with the person involved, and she's very much into sharing her story with all you guys. So the case is real. It was totally unexpected. And believe me, it's not what you think. Right? Famous YouTube expression. Now we've completed this podcast together. I know it was long as usual, but I also hope that you did get a lot out from it. And we now have you now have the opportunity to send us some questions, and hopefully we can provide some answers. That can be done by writing your comments um, below this screen in the podcast, as you know, and we'll get back to you, or even send us an email, and we'll try to get back to you as soon as we can. So thank you again for being here, and we hope to see you on the next episode. Take care. Please remember to like and subscribe. Have a good day. Bye.